Inserting a nasogastric tube. Prior to this procedure, the nurse will check physician's orders, check client's identiband, and ask client to state name. Discuss the procedure with the client. Provide privacy. Gather equipment. Position client at 45-degree angle or higher with head elevated. Wash hands and don clean gloves. Examine nostrils and select the most patent nostril by having client breathe through each one. Place towel or protective pad over client's chest and emesis basin within reach. Establish cueing signal for client, such as asking client to raise his hand to pause during the procedure. Measure from tip of nose to earlobe to xiphoid process of sternum to determine appropriate length for tube insertion. Mark tube with tape. Coil end of tube over fingers to prevent tube from dangling and touching objects. Lubricate first 4 inches of tube with water-soluble lubricant. Insert the tube through nostril to back of throat. Aim the tube toward back of throat and down. Suggest client swallow to assist tube insertion. Instruct client to flex head toward chest. Use a flashlight to locate tip of tube at back of throat. Continue advancing tube, giving the client sips of water until mark is reached. Attach syringe to free end of NG tube to check position of tube. Inject 10 to 15 milliliters of air through NG tube. And listen with stethoscope over stomach for rush of air or whoosh sound. Inject 1 or more 20 milliliter bursts of air into tube before aspirating fluid for pH. Aspirate gastric contents with 50 milliliter syringe and check pH, which should be less than 4. Obtain X-ray if ordered. X-ray is the only definite method to check placement, though not routinely ordered. Tape tube securely to nose. Clamp end of tube or connect it to suction. Secure tube with tape or rubber band pinned to client's gown. For a Salem Sump double lumen tube, maintain blue pigtail position above level of client's stomach and insert anti-reflux valve blue tip into blue pigtail of Salem tube. Provide regular oral and nasal hygiene. Remove gloves and wash hands. Position client for comfort. Document procedure.